Hi, I'm Jennifer and I work at Sacred Heart Hospital as a respiratory therapist slash pulmonary educator. So what I do is I help people with their lung disease, and I help them by helping patients quit smoking, and I also teach them how to quit smoking, and I also work with parents who have newly diagnosed children with asthma. So I teach the parents how to treat their children with asthma. I work Monday through Fridays, and I work during the day. As a respiratory therapist, this is something that you can branch into by doing education and furthering your career after you've become a respiratory therapist. So the stress level for my job is pretty low. It just depends on the day. On a daily basis, I could see up to 15 to 20 patients. And typically we're just talking about quitting smoking, or if I'm seeing asthma children, then I'm talking to the parents about how to manage their children's their disease state. So it's a real learning experience for both the patient and the parents when we're talking about asthma. What I would recommend is to do your degree in respiratory therapy, especially if that's something that you're interested in, and you can stay in the field and work with patients and learn your disease processes for the different respiratory diseases. And then if education was something you were interested in doing, you could move towards the teaching aspect where you would help patients quit smoking, or you could teach parents and people about their asthma. That takes a little bit more education as well, because you need to learn, you have to go back to get certain certificates and degrees for that. So then you'd have an asthma educator's certification, and then we also have a certified tobacco specialist. So that means that we can work with people to help them quit smoking. We also teach classes, and we do that a bunch of times throughout the year to help people quit smoking, which that's something that you have to stick with them a lot to help them learn how to quit, since they are such a hard habit to quit. It's good to have good people skills, I think, and be able to communicate with your patients and kind of come to their level and understand their disease and understand how they feel about their breathing problems. It makes it easier for them, and then they can relate a little bit better, especially if you took care of those type of patients prior to their getting sick and the point they might be at now that they need to quit smoking. Okay, so the best part of my job is that I get to help people every day and help them quit smoking, and when they are successful, it makes you feel good because they come back and they're not smoking, and they feel good about quitting. And another good thing is when my newly diagnosed children with asthma and the parents are there, then I can help them understand the disease. They know how to treat their children, how to take care of them, and how to make them better and keep them better. So those are some highlights. I also do asthma camp, so that's a good thing that comes out of my job. I help with the Sacred Heart asthma camp. And then, now the worst part of my job would probably be the patients that struggle to quit, and there's just can't get them to quit sometimes, and you feel like sometimes you're letting yourself down because they're not successful, but you know you've taught them everything they need to know. They just can't get there. And maybe they're not always so gracious for you to be there. But other than that, I think there's not really a whole lot of downfall, especially if you get a couple people to quit smoking. So final words of advice for someone that wants to come into my line of work, I would say that there's not a broad opening for this job, so you would probably need to have some good education skills behind you. Also, never stop learning. If you're already in a respiratory situation and you're ready to do some education, branch out, start looking around where you can teach or you can help people with their asthma, because usually you can go into the different disease states and help from that aspect. So you would go to asthma or cystic fibrosis or bronchitis, or people that smoke, help them quit smoking. So there's always information out there to help lead to that.